My name is Anas Arimiao Anas. I'm an investigative reporter from Ghana. Because I go undercover and expose dangerous people, I never reveal my true identity or show my face on camera. I made this film at a time of national crisis.
Fellow Ghanaians, it is vital that we protect the lives of our frontline health workers who are risking their lives every day to battle this virus.
As the coronavirus swept through Ghana, our health workers were the first line of defense. But while most Ghanaians pulled together to save lives, some put their colleagues at risk to turn a quick profit.
810. Okay.
Africa Eye goes undercover.
7, 8, 9.
To investigate the hospital staff willing to sell out their colleagues.
He was a great physician and very dedicated. And so his loss is very, 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 very bad for the hospital, for Kumasi, and for Ghana as a whole.
The body of the first doctor to contract and die from COVID-19 in Ghana is laid to rest. Dr. Harry Boateng was the medical director of a hospital in the Ashanti region. "96 doctors and nurses working in hospitals in this region have also tested positive for the virus."
In the case of our boss, we didn't have any sign that he had COVID. Then, early Saturday morning, we received the news that he has passed away.
No one knows who will be next to lose their life.
We are all shocked. And nobody is immune.
In all my life.
To find out what happened, I am talking to Dr. Randolph Ba Edu, a close colleague of the late Dr. Boateng at the Kwadaso SDA Hospital in Kumasi.
I am the leader of the COVID emergency response team of our hospital.
Dr. Edu's team treats the most seriously sick coronavirus patients. That makes them the most at-risk staff exposed to high doses of the virus on a daily basis.
We are all equally at risk, and you need to protect yourself as much as possible. So we need personal protective equipment, protective clothing, surgical face mask, face shield, helmets, the coveralls. But we don't always have them, and that is where the problem is.
The outbreak in the Ashanti region is the latest in an ongoing national crisis.
For the doctors, we are still counting, and I can tell you that we have more than 100 doctors currently infected with the COVID-19, and already we have mortalities.
Dr. Frank Srebo is Vice President of the Ghana Medical Association.
It's important that we have PPEs to be able to protect ourselves. Without it, we are almost going to battle without any protection.
Ghana's battle against COVID-19 began in March. The first outbreak was in the capital city, Accra, and the government was quick to react.
I took the step to close all our borders, and I ordered a mandatory quarantine and testing. If we act now, purposefully, we have a chance of preventing an escalation of our numbers.
The Greater Accra Regional Hospital was ground zero in our nation's fight to keep the virus under control. A testing center from where patients were referred to isolation wards and critical care units across the capital. The government instructed the hospital to obtain PPE by any means necessary, and wealthy donors provided thousands of items.
We are presenting 100 gowns, 100 masks
to help keep its staff safe.
You are the frontline defense of the population against the disease, and we must all support you to be able to protect us.
But I received multiple reports that some of the hospital staff had formed a clandestine network to cash in on the crisis by diverting PPE and selling it off. So I decided to investigate. A source who works inside the hospital has pointed me to a man working in its pharmacy, Thomas Osei. My source says Thomas is selling PPE to private clients. I instruct an undercover reporter to call him and ask to buy 2 medical-grade overalls, an item in short supply. Thomas agrees and says he can even come to the hospital to pick them up. My undercover reporter asks him to add another set of overalls to the deal. Thomas charges 600 Ghana cedis, or $105 for the 3 protective suits, designed to protect intensive care unit staff from infection. In the middle of a national crisis, Thomas is prepared to sell life-saving PPE to line his own pockets. But just how much of this vital safety equipment can Thomas get access to? Before leaving, my reporter asks to buy even more protective overalls. Thomas finds 2 more suits for us to buy.
Why will it come out?
It's another 400 cedis, or $70. My reporter turns the conversation to the frontline medical staff at Thomas's hospital.
It's not easy. Your people are there, your family. You leave them, you come and risk your life on these people.
Yes, because they're risking their lives.
Thomas knows the risks they are taking, but seems not to care. He is selling off PPE that could be the difference between life and death for one of his colleagues.
They're risking their lives, Charlie.
For less than $200, he has just sold them out. While Thomas sold off vital PPE in Accra, frontline workers elsewhere were suffering major shortages.
Okay, so now let's get to the main ward, and then at least you can see 1 or 2 patients.
Ghana Medical Association Vice President Dr. Srebo manages this hospital on the outskirts of Kumasi.
Basically, we just started the hemotransfusion.
It's in the center of the latest outbreak.
Going into this battle, we know that definitely health workers were going to be affected. But of course, the major challenge is that at least every single health worker at this moment requires some minimum PPEs. So there should be some goggles for you, there should be some glass for you, there should be some masks for you, and an apron for you to be able to do your work. Until that is done, you put yourself squarely at risk.
The government claims it has donated PPE to the Ashanti region, But local doctors say not nearly enough has arrived.
We are informed that so much PPE have been procured by the government, and yet when you come to the ground, you don't see them. I've spoken to doctors who even go to the extent of buying their own PPEs. And I've used my own personal money to ensure that at least we are able to move without running into problems. And I'm sure if nothing is done, I'll have to continue doing that. We are getting some, but it's not enough.
Dr. Serebour can't believe that his fellow health workers would try to make money from this vital resource at a time of national crisis.
If I hear that another health worker has sold them, I'll be very surprised. And indeed, I'll be very angry. Because at the end of the day, what it means is that you put your colleagues at risk, they'll get infected. But remember that once they come into contact with you, you also get infected. And what becomes of the money that you get?
Back in Accra, I receive a message from Thomas. This time, he offers me something physicians are crying out for: transparent face shields, as well as more medical-grade protective overalls. Thomas takes my reporter to a staff canteen inside the hospital to wait.
No problem.
30 minutes later, Thomas returns with 9 sets of overalls.
These are the white cap. This one is like, it's very light. I thought it was going to be heavy like the other one.
That one is due to the workers, the nurses.
Is it the same type?
Yeah.
Is it the same type?
The same distance.
Okay.
Thomas seems completely at ease, unconcerned about selling off this life-saving medical equipment in plain sight within the hospital.
This person seen it. It did not create any problem. Your colleague, no?
Oh, no.
The critical importance of the items Thomas sold us was made clear to me by Benedicta Osei-Tutu, a nurse working directly with coronavirus patients.
I'm a nurse in the COVID team. COVID-19 is very contagious. So as a nurse taking care of patients, the fact that someone is coughing or someone is sick and you still need to go. So I wear a mask, pray to God, and move.
Deprived of protective equipment, hundreds of nurses and midwives across Ghana have already tested positive for coronavirus.
So PPE is not just face mask. You need your gloves. You need, we have something called a boot cover. You need a face shield. You need a goggle. You need the coverall, which should be disposable. Yes.
Benedicta says medical overalls are what she needs the most.
When the COVID started around March, they brought 15 pieces for the whole municipality. 15. Like the shortest possible time, that 15 got finished. So since then, personally, I've never been in coverall to a suspected case. Some people think I'm immune to the virus, which I'm not. So without the PPE, you are exposed, so you can easily contract the disease.
Face masks can help stop the spread of this respiratory disease. But for frontline medical staff, plastic face shields are essential. They are in short supply. Yet, Thomas tells my investigators that he has 9 medical-grade face shields ready for sale. He even gives my reporter a tutorial.
So you go, let's go this one. Then put another one for there.
Then you face it there.
Place it there. You put on for your head.
Let's try it and see.
Thomas's sideline in PPE does not seem to be a secret. He even seems to pick up another potential sale as he is handing over the goods.
Wow.
There are how many?
9.
9.
Yeah. So let's count it.
6, 7, 8, 9. Which will be
So it should be around 870.
810.
810 cedis for the face shield, plus another 1,800 for 9 sets of overalls. $450 US to remove 9 sets of full PPE from circulation. We wrote to Thomas, offering him an opportunity to respond to the allegations in our film. He admitted he had been running a business selling PPE on the premises of the hospital, but he claimed the items he sold were all purchased by him from private pharmacies in Accra. He even provided receipts for the face shields and overalls. So I contacted the business owners. While accepting that they had sold the items, each claimed that Thomas had come to them after receiving my letter and asked them to produce fresh receipts. The receipt for the face shield was from a pharmacy chain called Unicom. Its CEO, Patient Chaga, agreed to an interview.
Unicom Chemist started selling PPEs as far back as the 23rd of March 2020, when the COVID-19 situation in Ghana became a serious issue.
She says her company were led to believe that the face shields sold to us by Thomas were ordered for the exclusive use of hospital staff.
On the 9th of April, they had a call for a purchase of 9 face shields to be delivered to Rich Hospital, and I do not condone in selling to hospitals for private people to sell to the public.
Face shield. It's unbelievable. Wow.
Dr. Hadi Abdallah is one of Ghana's leading surgeons. He's been treating coronavirus patients since the crisis began.
The one that we are sewing here too. This is ridiculous. Oh, no. This is so bad.
I showed him my video evidence of Thomas's activities.
If you look at the face shield in my head of department, tried on it on his own to try and create some for us. And apparently we had some in the country and people were selling it. Like that's wickedness. Every 2 weeks, the president makes a statement, tells the public how much PPEs they have contributed towards the fight of COVID. And we on the ground never saw it, and we kept complaining. I can imagine what the president will be feeling when he sees this. I can imagine. There are people working without these things, putting their life at risk. I mean, we can't run our country like this.
There was so much to buy that I had to even stop buying because the stock, they just would ask, how much do you need? And once we were to mention it, it was always available.
This is unbelievable. I'm sure it goes beyond even those that we see on this video. This clearly shows that we don't have a tracking system of our stocks.
I also brought samples of the items for him to inspect.
These are the real coveralls.
The ones that I'm most disappointed in is the sales of coveralls. Because of greed and selfishness, they deny these health workers of this. I mean, what are those people going to say about the health workers that we lost?
But it seems Thomas isn't the only one at the Greater Accra Regional Hospital who is eager to cash in on the pandemic. My source tells me that PPE stocks are running dry at the facility. The hospital has started making its own protective masks on site. And a member of the sewing team, Divine Kumoji, is selling these hospital masks. I decide to put these worrying claims to the test and instruct my reporter to buy 100 face masks. Divine is waiting at the elevator door. He seems relaxed and ready to do business. The bag contains 10 bundles of 10 face masks, 100 masks in total, all made on site and meant exclusively for hospital workers. Yet another case of profiteering at the time of national crisis. Divine appears happy with his 800 cedis or $140 and unconcerned about 100 masks he has just removed from the hospital front line. And he now seems ready to sell us whatever he's asked for. I showed this footage to renowned surgeon Dr. Hadi Abdallah.
Even in my hospital, the tailors of the medical stores were encouraged to sew, you know. But it's unbelievable. I mean, this is too much greed. This is after depleting the stores of the proper face masks and the PPEs that we needed. This is what was going to protect them and their colleagues. We work in a system where people were told that they had to manage with 2 or 3 masks for a whole week. If they can be so callous and wicked like that, knowing that when health workers don't have this protective gear, they are putting their lives and the life of their families at risk. I think they don't deserve to work there, and I think they should be severely punished by the law.
We put these allegations to the senior management of the Greater Accra Regional Hospital. They responded soon after, stating that following an internal investigation, both men had been suspended from duty for privately selling PPE in breach of hospital rules. My country stands tall in the world for its response to the greatest crisis in a generation. While rich countries in the West buried their citizens in the tens of thousands, our death toll from COVID-19 has remained far lower. But this fight isn't won yet. The virus is still surging through hospitals and communities, both here and abroad. Standing between us and disaster are our healthcare workers. We must all pull together and protect them at all costs.